In tonight's Health Check 7 report, the early signs of a stroke and how important it is to get treatment as soon as you experience them.
2 years ago, Sandy Pryor, who is the director of emergency services at Baptist Hospital, was going about her usual day with no problems, talking with a colleague.
She and I had a conversation when she was just talking to me, and I started to say something, and when I did, it didn't sound like my voice to me. It sounded like I was having trouble with it, so I quit talking.
But she was not convinced anything major was wrong until a few minutes later, during a conversation with a nurse, when Sandy couldn't get any words out.
I wanted to say I need help, but there wasn't any way I could get it out. So at that point, she realized I was in trouble, and they put me in a wheelchair and ran me straight here to the emergency room.
Sandy was having a stroke, but since she was already in a hospital, she was treated right away, never lost consciousness, and did not require surgery. A clot in her brain was dissolved with an injection.
There's nothing more important when you're talking about taking care of stroke victims than being able to intervene early.
And that, Dr. Paul says, means within 3 hours of the onset of symptoms.
Then we're able to use special medications and special radiological interventions to open up the blood vessel that's causing the problem, and that really gives us our best window of opportunity to improve their overall results.
In Sandy's case, that may have saved her life, or at the very least regained the memory loss and loss of movement she experienced.
You may think you're very healthy and that this can't happen to you and you've taken really good care of yourself or you have all this knowledge, but it can. That won't protect you from having a stroke. So I would just say be very attuned to what your body's telling you, rest when you need to rest, take care of yourself.